All right, good evening, everyone, and welcome to Atp Live Monday. Welcome for those joining on Facebook, on Instagram, YouTube. You're welcome. And I'm just going to share the videos. So uh, I encourage you to do the same. Okay. So ATP Live Monday is a program where you get to ask any questions that you may have about the health of your children in 1 hour, and we try to answer them. So that's what we're going to be doing today. I hope today's the last day of September, so we got just 3 months before the end of 2024. What a year! All right, so I hope you've had a good year so far. If not, well, there's still a few months in the year. So welcome to ATP Live Monday. I am Gbemisola Boyede. I'm a pediatrician and I'm your anchor for today. And I'm going to be answering any questions that you may have about the health of your children in the next 1 hour. So if you have any question, you can start to ask your questions now, and I'll do our best to answer them. What I'm doing now is just making sure I share the links to all the groups and all our platforms so everybody can see and everybody can hear. Please do the same. Invite your friends and family, invite them to join us now. Anybody that may have questions for a pediatrician, that is. We just want to learn about health of children. So invite them to join us now. So as you are joining, feel free to drop your questions. Please start with the age of the child. It's so important to us to know the age of the child, because as you all know, we as pediatricians, we deal with a lot of children according to different age categories. So, by virtue of that, the way we respond varies depending on the age of the child. So, it's so important for us to know the age. The answers will be completely opposite depending on the age that we're dealing with. So that's why it's always very, very important for us to know the age of the child. And I'll try and give us a quick summary of why you're asking, your concerns, and of course, ending it with a very, very specific question, you know. So if you just leave comments, we will not know what to do with it. But if you are very specific, then we can know what your expectation is, and then we'll be able to answer the questions. So I think those are just the basic uh, housekeeping announcement. If you are on the page, or if you are on Instagram or YouTube, you can just drop your questions straight away under the video you're watching, and I will see it and I'll be able to answer your questions. However, if you are on the groups, any of our groups, because we are sharing the page links to the groups. So if you're any of the groups, you really need to click on, if you have a question, you have to click on the video, so that you have to put your question directly under the video for me to say it. But if you're not asking any question, you are happy to watch in the group. But if you want to ask a question, you have to remember to click on the video and then ask your question directly under the video that is on the page, and that is the only way I'll be able to see your questions. Okay, but for those on Instagram, those on YouTube, just on the Facebook page, you are free to just drop your own questions straight under the video you're seeing, and I'll be able to answer them. So, good evening, everyone. Good evening, Instagram. Good evening, Facebook. Um, Good evening, YouTube, and good evening, everyone, whichever platform you're watching from. Okay, I think I'm done with all my sharing and pinning, and I think I'm ready to start to answer any questions. Okay, so once again, let me welcome you all to Ask the Pediatrician Live Monday, ATP Live Monday. This is a program where you get to ask and get answers to the health of your children. I have just 1 hour to do that. Good evening, Emma Fee Constance. You're welcome. And those on Instagram, I can see you all. Welcome. Welcome. Good evening, Zuleika Wumi, you're welcome. And good evening, everybody. So feel free to drop your question. For those of you who are watching, start with the age of the child and then um, drop your concerns and ask your very specific questions, and we will try and answer them. And for those of us in Nigeria, happy independence in advance to us. Tomorrow is going to be our Independence Day. So ATP, as you know, we always have independence outreaches. So we will still be in schools, in our communities, trying to support us. And we look forward to our country being there for our children and being the Nigeria of our dreams. But yeah, no matter what the situation is, no matter how hard it is, we'll still keep on hoping and looking forward to a better Nigeria. So happy independence in advance to the Nigerians who are watching me and to everybody else. Good evening, Major Evers. Thank you for joining us today. Yeah, fast becoming one of our most consistent viewer on Instagram. Welcome. All right, so yeah, feel free to ask your questions. If after the program you still have questions, not to worry, go over to our Facebook group. You can ask a question on our Facebook group from Mondays to Saturdays, and we'll do our best to answer them at least within 24 to 48 hours. We always answer most of your questions. Of course, if your child is in an emergency situation, please and please take the child to the hospital. Okay, a group on Facebook is not, never can be a replacement for our doctors, our hospitals, our nurses, our health professionals. So there are still things that you have to take your child to the hospital for. We are just here to support you, to provide education, to provide information, to limit the number of times you have to go into the hospitals. Because if you are taking note of all our health promotion and health information and doing all the right things, hopefully we will not need to see you in the hospital. But also, if there's a need to go to the hospital, at least then you know and you can go as soon as possible. So thank you so much for joining us today. Okay, I got one question from Major Heves on Instagram. You say your baby is on exclusive, but it strains to poo a lot. Okay, so straining or making sounds to poo is not the same thing as constipation. I know it's something we as adults, we tend to confuse the two together. So, but it is not the same. So the most important thing, major, is whether your child is passing hard stools. Okay, and I think I always show the picture of the stool chart. Let me see whether I see have it on my here so I can show us. Do I have it? I hope I've not deleted it. Okay, I have this Bristol stool chart. So I hope you will eventually see it on Instagram. So there are about 7 classes. So what matters is the texture of the stool. So if your child is passing normal stool, which is like type 4, if you are seeing my charts right now, that is normal. Even if the child is making all the noises and making all the groaning and all that, that is not constipation. So what's definition of constipation? It has to be hard stool, usually type 1 to type 3, and it has to be infrequent stool. So the child is not passing the stools frequently, and when the child passes the stool, it is very hard. Babies on exclusive breastfeeding really don't pass stools that are hard. Okay, you've given me an update that the stool is normal. Exactly. So normal stool, Hegusi stool is normal, and that is normal stool, and that is not constipation. So babies in that age, newborns, they make a lot of grunting sounds when passing stool, when passing urine, when passing gas. It does not mean they are trying to pass anything hard. It is just their own how like an habit for them sometimes. And anything going out of their body or leaving their body is like a big deal to them, because they are very, very alert and conscious of it. But you notice that, like you rightly said, the stool that is passed is usually soft, semi-formed, like a goosey, a mixture of some solid, a mixture of liquid. That is absolutely normal. And as long as the child is passing normal stool, whether they make sound or not, that is not constipation. So that is normal, and you just don't need to worry. And all you need to do is to just ignore the the sound, and just let the baby keep breastfeeding exclusively. So I hope that is helpful. Babies on exclusive breastfeeding, sometimes they may not even pass stools at all. Again, because that's another thing mothers also confused with constipation, that oh, the baby doesn't go to toilet every day, doesn't move the bowel every day. They may not actually pass stools at all for even up to 2 weeks, and that is still normal as well, because eventually when they will pass the stool, it will still be hard stool, it will be normal stool, because most of breast milk is already pre-digested. And because most of breast milk is pre-digested, sometimes almost everything is absorbed, so there's very little left anyway to pass. So sometimes the baby may decide not to pass this one, they kind of accumulate it for maybe 1 to 2 weeks before they eventually pass it. Again, parents tend to confuse that with constipation. It is not constipation, it is still normal. Whereas some babies on exclusive breastfeeding, the other extreme is also correct. They may actually pass through every time they by the time they finish eating, they will pass through. So as they are eating, they are passing through. Again, it's also normal. So that is also not constipation. So babies on newborn babies, mothers tend to confuse the two situations. It's either they are worried that the baby is constipated because of the sounds, or because they are not passing stool frequently. That is not constipation. Or mothers are worried that the baby is purging or is having diarrhea because they are passing stools almost every time, 4, 5, 6, 7 times, and then they can even pass stools up to 12 times a day, and it is normal. You know what? They can pass stool every single time they eat, and that is not diarrhea. And sometimes some people look at that egusi stool because there's a little bit of water, there's a little bit of solid, and they think, oh, that is diarrhea. That is not diarrhea. For diarrhea for babies, it has to be completely watery, like no solid whatsoever, just only water. That is where we classify as diarrhea for babies on exclusive breastfeeding. So it is important that we don't confuse the two, which is why I always want to ask when mothers tell me my newborn is having diarrhea, or my newborn is having or my baby is on exclusive breastfeeding, is having constipation, or is having diarrhea, we always need to ask you a few more questions. And once we get the answer to those few questions, we can easily uh, rule out the constipation or diarrhea. So babies on exclusive breastfeeding don't have diarrhea. They also don't have constipation. So their own stools is a little bit different, but it's still within normal limits. So, and I'm happy you were able to give me that information, and we could confirm that your baby does not have diarrhea or constipation. I hope that's helpful. All right. So, welcome to those who are just joining us. For if you don't know where you are, you're on Ask the Pediatricians Live Monday, ATP Live Monday. Feel free to. This is a program brought to you by Ask the Pediatricians Foundation, where you get to answer ask. Sorry, you get to ask any questions that you may have about the health of your children, and I have the privilege of answering them in the next 1 hour. For those of you who are watching live, you can ask the questions now and I'll answer them. I know some of you may come later after the live session is over. Thank you, Debbie Benjamin. Thank you for joining us. If you're watching after 7 p.m. on a Monday or any other day, then most likely you're watching the recorded episode. And in that case, you won't be able to ask your questions live. So for those category of people, this information is for you. When you finish watching, go to our Facebook group, Ask the Pediatrician Facebook group, and you can post your questions there, and then we will answer them. We promise to answer them within 24 to 48 hours. Okay, I've got one question from Facebook from Constance. Thank you for joining us. Thank you very much for all you do. Thank you. What would be the cause of a baby spitting up after breastfeeding? Okay, again, spitting up is one of those things that babies do. It's not like what is the cause. It's just one thing. It's one of those things that happen in babies, and it's not a big deal. We call it reflux, and I guess I explain this almost every week. And it's because number one, babies are on liquid, and they tend to be lying flat most of the time. They have a very small stomach. The space, the gap between the mouth and the nose and the stomach is pretty short in them, and so it is. And then the gates, the sphincters are supposed to keep the food in the tummy, is not yet fully matured. So in that age group, and most of us, immediately the baby finish feeding, we just tend to put them down, so it is very easy for the liquid to return and come back through the mouth or sometimes through the nose. That is just what we call anatomy and physiology. It's just the way children, babies are. So usually as they get older and their foods change from liquid milk to they start taking semi-solid and solid, reflux also goes down. So the way to help them is that when you finish feeding, don't put them down straight away. Try and keep them upright. After feeds, we should actually recommend 15 to 30 minutes. I know most of you are too busy, but you can still put them in a maybe like the chair and sit them up a little bit, and so that the food will go down. Even when you do that, there will still be a little bit of spit up because again, the tummy is short, the distance is, is short. When baby is trying to bring off some of the gas, a little bit of the milk comes out with it. So it is nothing to worry about. Again, by the time most babies are 1 year old, by the time they're fully on solid, that is it. And as they get bigger, the distance increases. So it will be a thing of the past. It's nothing to worry about. It doesn't require any special treatment or anything. And that is that. However, some babies can have very severe form of reflux. In other words, some babies actually bring out quite a lot and sometimes almost everything. And the way you will know when your baby is having a severe form of reflux is the fact that the baby will not be gaining weight, because baby is bringing out almost all the milk and then they will not gain weight. So those are the kind of babies that you need to see us for, and those are the ones that we will now treat. We have other options for treating children with severe reflux who are bringing out quite a lot of milk and who are not gaining weight. So if your baby, some of you say, oh, maybe my baby is having severe one. If your baby is gaining weight, your baby is otherwise well, please, your baby doesn't have severe reflux. Babies that have severe reflux, they bring out quite a lot, almost all the time, every food, and then they don't gain weight. So sometimes for those babies, we have to take in the breast milk for them, and sometimes we have to give them some other medication like antacids and stuff like that. So that is how we manage that. Okay, so sometimes it can be much, sometimes little spit up. She spits up if she looks a little bit, if she looks away a little bit when feeding. Anyway, your baby's birth weight is 8 and your baby is 5 months and your baby is 5.5, which means your baby is almost doubling the birth weight at 5 months. So I think your baby doesn't qualify as having severe reflux. So what you need to do, feed the baby, keep upright for 15 to 30 minutes. Just keep feeding. When your baby is 6 months, you start semi-solid complementary feeds, and most of this spit up will reduce. Most of them will stop by the time they're about 1 year. All right, let me quickly go to Instagram and take a couple of questions. Miss Fumi say, hello, ma'am. I noticed my 2 months old baby tongue has dark patches. That's very unusual for a newborn to have dark patches on their tongue. I hope you are not giving the baby any just check what you're giving the baby. I hope you're not. Are you giving any drugs? Are you giving any other food apart from breast milk? So just pay attention to that. Normally, babies may have milk coating on their tongue, and which usually you just get a clean clothes and a clean what's it called, like a clean handkerchief or something, and you just wipe it off, and that is it. But for babies that have oral thrush, when you try to clean it off, it doesn't seem to go away. For those kind of babies, you have to see a doctor because they have oral thrush is a fungal infection, and they have to prescribe maybe anti fungal medication for your baby. So, but dark, if you are not giving any drugs or anything, and your baby has this dark patches on the tongue, and it's not that the baby is sucking on anything that is dark, you may want to see a pediatrician, because that is actually not normal for babies to have dark patches on the tongue. I hope that is helpful. For those on Instagram, I hope you can see me because this my hand here looks as if it's frozen. So I hope you can. All right. Let's come back to Facebook. Mia Barrett says, GP said my son has HFM. What is HFM? Please always try and write in full. Avoid abbreviations because abbreviations can mean different things to different people. So this rash is everywhere and pulsing. Okay, maybe has rash. Uh, Pulsing like bringing out pulse. He hasn't passed urine since 11 yesterday. I'll be worried if a child. This is I don't know where you are where you are asking the question from, but definitely a child who has not passed urine for almost, this is 6 p.m. and that is almost it's going to almost 18 hours, if not more. I would definitely be worried about that child. I really think you will need to go back. I think this is a child you may actually want to call the hospital. You may want to go to accident and emergency for if a child is not passing urine. I'm actually more worried about the urine than the rashes. It is not normal for the child not to pass urine for almost a whole day. Is the child so is child you didn't tell us how old your son is. Please always start every question with the age of your child. So it's very important for us to have a context. But even if it's no matter which age, any child that's not passed urine at all for almost 11 for more than almost 18 hours, that child needs to be in an emergency room. I really think you should call and get that sorted quickly. There may be that the urine may be in the bladder and it's just not being passed out, which is fine. And at least we know the child is making urine. And then we now need to know why is the child not passing it out. But if the child is not passing urine at all for 18 hours, I will be worried. And I really want you to get that child reviewed by the doctors and make sure that there's nothing going on there. All right. Okay. 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 All right. Let me go back. For those on Instagram, I think I have an issue with my Instagram. We'll sort it out. so that I can see your question. Um, okay, so for Instagram, please just let me know you can hear me. Let me just go back to uh use my phone Instagram so that I'm sure I can see your question. But if you've asked any question, please ask your question again if you're on Instagram so that I can answer it, because I've to refresh my Instagram and it appears I may have lost some of those questions. Okay, Miss Sumi, thank you for confirming that you can hear me. All right, so if you have asked a question and I've not answered it on Instagram, please just ask again because I wasn't too sure. So, all right, so Odudele Feishayo say, well done, ma. Please, does sitting cause drooling? Yes, children can drool more when they are sitting, so that is normal. Yes, and it's nothing to worry about. My baby is 10 months, start opening her mouth and drooling. Again, she's having cough. But they drool only when they are bringing out teeth. You are not telling us whether your 10 months is trying to bring out a new tooth. So if it's bringing out a new tooth, yes, that can make them to drool. But and once the teeth is out, or the tooth or the teeth, depending on how many they are out, the drooling should stop. It shouldn't go on, okay? Your child is having cough and catarrh that is interfering with sleep, then you have to get the child evaluated at the hospital because it is not normal for a child's any cough and catarrh that is really severe enough to affect the sleep. That is severe, so that should be evaluated. So it may just be a respiratory infection. Most of them could be caused by viruses, which means they don't require any particular drug or treatment. But if your child is really having uh, bad um, difficulty with during sleep, then I really want you to see the doctors and get it evaluated. All right, I hope that's helpful. All right, I got a couple of questions on Instagram. So Miss Fumi is asking, what is my take on umbilical hernia in babies? I'm not sure what you mean by what is my take, but umbilical hernia is common in children, especially Black Africans. And what normally happens is that the the area the where the mother and the baby are connected, that is where the placenta is, is connected to the baby. So that is how the baby got nourishment and all that when in the womb. So usually when we cut the umbilical cord, when we cut it during delivery, that space is in navel. So hopefully it will heal and that hole should close. But in some babies, it doesn't close completely. And when it doesn't close completely, it's a little bit um of things inside the tummy can pass through that hole, and like intestine, like what we call the mentum and all that, they can pass through that hole. And that is what we mean by umbilical hernia. And usually most babies is usually very small, so a little bit of things from the tummy comes through and you can push it down. When baby cries or cough, it comes out more, it swell up. But when you push it down, it goes down, and most of the time it's fine, and over time it will close on its own. So usually those are mild ones. But some babies, the holes are so big, and so because they are so big, a lot of things may come out, and sometimes they come out to the point that they can't go back easily. So there's what we call obstruction, and when there's obstruction, it will cause pain for the child and all that. So usually for babies with the very tiny hole or small things coming out, we just leave it and hope it will close by itself. Usually by the age of 5 years, most of them would have closed. But for those babies who are very big hole in that navel area and a lot of things are coming out, or it gets to a point where some things come out and they can't go back. In other words, there's obstruction, or there's even what we call strangulation, like blood supply to those things are now being affected because they have stay too far in that hole, or they, it's too tight and it's causing blood not to flow to them, that is an emergency operation. So hernia treatment depends on how severe it is, how big or how small, or whether there are complications. So if it is small, we leave it alone. If it is very big, um, we have to um, repair it, do an operation. If it is causing complications, it also has to be repaired. So I think that is my take. I hope that is, I don't know whether that is what you are trying to ask, but please, there's no thing like putting pin, putting this, tying the tummy, all those things don't do anything. So just leave it alone. If it is small, leave it alone. If it is big or you're worried, see a pediatric surgeon. They will tell you whether it's something they can operate or whether they just want to watch it for now. All right. Thank you, Miss Fumi. So Ara Setina say, can you explain how speech therapy goes? Okay, I'm not a speech therapist. Um but I know speech therapists. I work with them, their colleagues. So how does speech therapy goes? Because here in the UK they just come to use toys to play with them. Yeah, that is how we do therapy. So therapy is um how do I explain it? So in speech therapy, usually for children who are not yet talking, we are trying to get them to talk. But most time parents, you're focusing on the the talking parts of it for the child, but there are certain things that precede a child talking. There are what we call pre-verbal stages of communication. So a child who is not talking should be able to understand what we call symbolic play and all those kind of things. So because actually when you look at it, language is just symbolism. So when I say dog, you don't think as dog, you picture dog, you picture an animal with four legs and all that, because in your brain, the way you learn language, you know that whenever you see the word dog, it represents an animal. But whereas in my own language, in Yoruba language, is aja, is aja, that will represent that same animal. So what I'm trying to say is that language is about symbolism. We've all agreed that when we use this particular letters together, it means this particular animal or this particular object, and that is it. So for a child to be able to speak, the child must understand that concept of what we call symbolism or role play. Must be able to understand that this if I pick a pencil or something like that, I'm trying to use it to represent something. So when the therapists are playing with the child, that is what they are doing. They are hopeful getting the child to understand those aspects of language. It is not everything that has to be when they're talking. So there is the parts where they are just understanding the pre-verbal stage of communication. So I know for you as a parent, it may not be clear to you what they are doing, but what they are doing is actually part of getting the child to that point of understanding. And then sometimes parents, we focus on what we call expressive speech, but there's also a part of speech we call receptive speech. That is a part of understanding things. That is the understanding. You need to understand first before you can talk. Sorry for all the distraction. I'm just trying to get my ring lights in the right position. So that is the what the speech therapists are doing. So when you see them, you can ask these questions. You can ask these questions so that you understand what they are trying to do, even though it doesn't make sense to you, but that they are still doing the right thing. I hope that's helpful. All right. Okay, I think I've answered the questions on Instagram. Let me go back to Facebook before Facebook people get upset with me. Okay, I got one question on Facebook. Constance, thank you very much for your response. Okay, you're asking now, can a child have malaria without mosquito bites? Let me answer it by saying you cannot have malaria without mosquito biting you. So the fact that you don't see the bite does not mean the child was not um contact, I mean, the child has not been bitten by mosquito. I hope that makes sense. Okay, but there are other ways of getting malaria without mosquito. But you can get malaria from blood transfusion. You can get malaria from the mother, can be passed to the baby. So when you say a child, you actually have to be very specific. So newborn babies can get malaria from their mother in the womb, and we call it congenital malaria. And then you can also get malaria if you've been given blood, because if they give you the blood of somebody who already has malaria, then you're going to have malaria. So, but otherwise, most people will only have malaria after they have been bitten by not even just any mosquito. It has to be female Anopheles mosquito, okay? And it has to also be a mosquito that has bitten somebody else that has malaria. It's so important for me to say all that, because a lot of mothers, immediately they see any small bites on their baby's body, bam, they started anti-malaria. No, it is not every bite that will lead to malaria, because if all of you in that house you don't have malaria and the mosquito has only bitten those of you in that house, nobody is going to have malaria, because the mosquito is more or less a transference agent. So it has bitten somebody that has malaria, taking blood that has malaria parasites, and then when the mosquito now goes to another person who does not have malaria yet, and beating that person, then transfer the blood into that person, that is when that person is going to have malaria. So it's so important for us to clarify that. So you don't need to treat mosquito bites, you only treat malaria. So that's the number one. So number two, you said, well, this is the second time in this month that my baby has feverish condition. Now let's go to the next point to say every fever is not malaria, because I know it's so difficult for Nigerians to believe, because it's only Nigerians that have that issue, so other people don't. So, but every fever is not malaria. In fact, people tend to almost kind of equate fever to malaria. It's as if once you have fever, it is malaria, and you see people start taking anti-malaria, and then people will be asking me that I've been taking anti-malaria, or why am I still not better? Because, and I'm like, why do you assume that the fever is malaria? Every fever is not malaria, okay? So that is the first thing we all need to understand. So if your child has fever, don't just assume malaria. You need to get that child tested first and know the cause of that fever. And it is the cause of that fever that will determine the treatment for that child. Okay. Why is it not showing again? All right. Okay. It's showing now. Um, so the fact that your baby has had malaria fever twice does not automatically means that your child has malaria. Okay, that is the second thing I need to clarify, because earlier this month she was treated for malaria and tonsillitis, but she has no mosquito bite. So I usually don't like this approach, and I know some doctors do it a lot. Usually, I'm sure it's most of the time they are not pediatricians. Most of the time it is our general doctors who do that, especially in Nigeria, because they assume everybody have malaria, no matter what. So if a child has tonsillitis, it is very unusual for that same child to have malaria. I mean, how horrible will it be for a child to have two illness at the same time? It's very, very unusual. So my own thinking is that your child most likely just have tonsillitis, but the doctor is just treating malaria as, because you're in Nigeria and every Nigerian must have malaria, which is not necessarily true. So if your child doesn't have mosquito bites, and initially for us as pediatrician, we want them to do a malaria test. It's best to for do that malaria test before you treat anybody. With those days, we just say your child has fever. We even empower parents go and buy anti-malaria, but we've moved away from that age now, because nowadays we have what we call rapid malaria tests that you can do in any hospital. We don't need a lab scientist and nothing. They just need to put um what's it called? They just need to put the blood, and quickly the test will come out positive or negative. So anybody can do that test. They can do it at any time of the day. It is very rapid. result comes back quickly. So for most of us, if you come to our hospitals, children hospital, we do the malaria test right there and there. We do a full blood count, and you wait. You sit down, you wait for within 30 minutes. We have the results. So we don't just have to treat malaria that is not there, because it's not the best. It's also not the best. So we wait until we see the results and we treat. So if your doctor suspect your child has malaria, they should test the blood for malaria. They shouldn't just treat the child for malaria without confirming that the child has malaria. So I'm not sure your child has malaria because number one, there was no blood test done, and they are only just treating this child for assumed malaria. And that is why you are now confused that your child is having fever and why is child having malaria. The child doesn't, we don't have any evidence yet that your child even have malaria, so we can't even begin to answer that question. So, and teething does not cause fever. Teething is a normal thing. That's another, I know this is what I spend most of my life doing. I'm doing it on ATP, correcting all this misinformation and assumptions. There's a lot of misinformation and assumptions that people make. Okay, number one, even in this your post alone, we have like 5 or 6 of them. So we're just trying to break them down one by one. So every fever is not due to malaria. Teething does not cause fever and does not cause any illness in a child. So, if your child is having fever, get a thermometer, measure the temperature. Because sometimes mother even tell me the child has fever. Okay, go and measure it. It's 37. That is not fever. That is normal temperature. So we even for want to be sure the child has fever. So I usually don't rely on my baby feel warm, feel warm. Yes, that is why we have an instrument, because your hand is not a correct measurement. Okay, there are so many subjective thing with the use of our hand. That is why somebody created that instrument called a thermometer, which every mother should have at home. Digital one, just put it in the armpits, in the mouth, anywhere, and you have the temperature. Temperature has to be above 37.5 for it to be to reach with fever. That's number one. Number two, so we've confirmed that this child has fever. What is the cause of the fever is the next question. And please don't add teaching to that list. Just remove it completely. Teaching is not in that list at all. Okay, because I'm saying that because lots of us mothers in Nigeria, especially, we always assume teaching, malaria. Those are not always the number one. Teaching is not should not even be on that list. Malaria only if confirmed by blood test. Not every fever is malaria. Like you rightly say, your child has tonsillitis. Tonsillitis can cause fever on its own. And the doctors will see the tonsils are enlarged, they are swollen, there are pulse on them. So very easy. The child could have ear infection. We look into the ear. The child could have throat infection, could have chest infection, could have urinary tract infection. Ideally, any child with fever, we should be testing their urine. These are things we should be checking instead of just jumping on the malaria wagon every time. So that is what we need to say. So don't listen to people, and that's why you are here on ATP to ask the pediatrician, because if you listen to people, you're going to get the wrong advice. So okay, I hope I've not gotten any question on Instagram yet. Okay, so I hope that is helpful, Constance. I've taken time to answer your question because I believe other people will benefit from uh question as well. So just to summarize, every fever is not malaria. If your child has fever, you have to give check with a thermometer, give paracetamol. If the fever is going more than 24 hours, so it's very high fever, 39, 40, you have to go to the hospital. And please, when you go to the hospital, don't just let them give you drugs. Let them prove to you what your child has. And proving to you does not come with blood tests. We start with examining the child. We look in the ears, we look in the mouth, we look in the throat, we check the urine. These are things we can do. And then if we still don't know what is the cause, if I look at the throat is he's looking red, he's looking swollen, I can assume, okay, throat infection. I look in the ears, I can see pus coming out, I can assume ear infection. I don't even need to do blood tests for that. But if I do all that and I still don't find anything, then I should do blood tests. I should check for malaria, check for urine test, check for urinary tract infection, check all that before I start giving the child drugs. And sometimes we do all the tests, it still come back normal. It could be a viral infection. because they will come back normal, the blood test will be normal, there will be no malaria. Sometimes we just watch. We don't always have to treat everything. We just watch, and fevers from viruses tend to just go on their own. I hope that's helpful. But don't listen to people telling you everything is 13. No, 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 it's not. All right. Anthony is asking a question. I have question too. Okay. It's a year plus. Okay, I think you are saying your child is a year plus and always suffer malaria. I hope, Anthony, you listen to my last answer and that this malaria is confirmed. Because when people say always suffer malaria, is it confirmed or just assumed malaria? Let's just say your child is always having fever. And even when you use word always for a pediatrician, I want to know what is always. Is it every day? Is it every week? Is it every month? Is it once in every 3 months? I always need to have that context. It's very, very important. So you take her to the hospital when she's not fine. The results always turn out to be malaria. Okay, she took all the immunization they do give at the government hospital, but at 9 months, I get to learn there are some immunization the government hospital do not give freely. Yeah, that one needs to pay for. Yeah, the government find difficult to finance. Yes, those one is it true? It's true. There are immunization that the Nigerian government do not give. There are not many, but there are a few of them, but they are not like they are not for conditions that we're worried about. So things like chicken pox, things like mumps, things like rubella, they are not the big deal conditions. But if you, of course, you have the money, you can take them. But please, for those of people who go to private hospitals and take all this immunization, some of them are trying to rip off parents and they just put so many vaccines. Some of them are absolutely unnecessary because even the World Health Organization does not recommend them for children. So things like cholera vaccine, don't take cholera vaccine for children. It is not recommended. Cholera vaccine is only recommended for people who are going to where there's an outbreak of cholera. So those are the people that should take cholera vaccine. Hepatitis A, same thing. It is not recommended for routine administration to children. I see people in Nigeria taking flu vaccine. We don't have flu in Nigeria, so don't go and waste your money on that. So if you want to take any extra vaccines, you can take your MMR if you really like to protect against mumps and rubella. If you don't worry, your measles is fine. If you like, you can take your chickenpox vaccine, because most people will have chickenpox at one time in their life. If you don't want to go through the chickenpox phase, you can take the vaccine. Otherwise, most of the other vaccines, we have them, we give them for free. So that is number one. Number two, if you're always going to a hospital and they are always confirming malaria, change your hospital, because I have a feeling some of these private hospitals don't do those tests and they always say your child has malaria because they just got to treat the child for something. That is fraudulent. I know it's not right, but people do it. I can tell you for free that they do it. So if I were you, maybe the next time your child has fever, try a different hospital or try a different lab, preferably a government hospital. Let them do that test there. Let them show you the results, because it is whatever they wrote to you, malaria 1+, 2+, they always put it there. You didn't see it when it was done anyway. So you may want to try people or labs that have integrity. So if you want to try private lab, it used to be Patcare. I've forgotten their current name now. There are labs that are of standards. When they give you tests, you can trust it. That is private, but most of government hospital, they have nothing to gain in whether your child's result is positive or negative. So they're going to give you the correct results. So you may want to try those first, because I will worry if every time your child is going to hospital, your child always has malaria positive. It's very, very unlikely. And even when children have malaria, sometimes the result comes back negative. We have what we call false negatives. In other words, we take the bloods and the child has malaria truly, but the result will be negative. But then if your child's result is always positive, especially if you're going to private hospital, I will put a question mark on it. That is number one. And some private hospitals, once you go there, they will always treat your child for malaria and infection. Those are the only two things they treat. Or some of you that go to the malaria typhoid hospitals, everybody must have malaria and typhoid together. all those things are not true. It's nonsense. People don't tend to have typhoid that frequently. And when you have typhoid, you are really sick. It's a very serious illness. All these people that are walking around the old streets of Lagos and saying they have malaria typhoid, it is not true, okay? And so be wary. I'm very wary of those hospitals where they always give you malaria and typhoid diagnosis, or for children, malaria and infection diagnosis. Some of them, I have a feeling they don't actually do those tests, and they already have their premeditated results. So, right. So the lab result you get is as good as the place and the people who are doing it based on their integrity. So if you don't want to get yourself caught in that issue, you may want to go to places where you know that they are going to give you the real thing, the truth, and nothing but the truth. Then, so that's number one. Then number two, your child having frequent fever does not necessarily mean because your child has not taken immunization that we do not recommend. No. So I will really recommend that your child need to see a pediatrician, which is what they should have done. If your child is having fever frequently, you didn't tell me how frequent, because you say always. Always is not very specific. I want to know how frequently this child is having fever. So, because if your child is having fever frequently, that child needs to see a pediatrician. We need to know why. There are other very sinister causes of frequent fevers or recurrent fevers. We need to test, and it is beyond malaria and full blood counts. We need to do other tests. We need to do, even sometimes we're doing bone marrow analysis, we're doing blood culture, we're doing urine test. We're looking for other causes, not just malaria. So if your child is having fever all the time, always, like every week, 2 weeks, 3 weeks, you have to go and see us a government hospital, people that know what they're doing, so that the pediatrician will see the child, and then they can now do the right thing. It is so important, please. So Mr. Anthony, I really think you, if your child is still having that fever, please go to a hospital, probably a government hospital, a general teaching hospital that has a pediatrician. Let them do a proper evaluation of that child, and let them tell you what is wrong, and take it off from there. But your child should not be having malaria so frequently, and we need to know why. I hope that is helpful. If you are still listening to me, let me know that. So you were asking what is the danger of not taking the other vaccines. I think I've answered that, but just to clarify, there is no danger. It just means that your child can have the conditions for which the vaccines are not given. The government has tried. When I started ATP almost 10 years ago, there was no rotavirus, there was no pneumococcal vaccine. Then we were telling people you have to go take pneumococcal. I think Prevena, then people were paying 20,000 naira for it. That was a lot of money then in 2005, 2015, sorry. So it's a lot of money. Rota was not there. But now the government has added Rota, we've added pneumococcal, we have added the meningitis vaccine. So the government has really tried, and they've expanded the free immunization. The reason why I'm saying this is because last week I saw a post on Facebook, and somebody was trying to advise people, like, so that you don't, like, family planning, the kind of cost of childcare, especially immunization. The person has gone to a private hospital, and they've given her immunization bill of, is it 120,000? Is it 270,000? I think it's 270,000. It's so ridiculous. So even the person was so worried that why is it so expensive? So she was posting that, like, just to kind of encourage people to do family planning and all that. But what I agree with the message, but the issue is that you don't need to pay 270,000 for immunization for your child in Nigeria. It is absolutely unnecessary. And I looked through the list of those immunization that she was going to pay for. So I was saying things like cholera, your child should not take cholera vaccine to start with. I saw MMR. Yeah, MMR is okay to take if you want, but the most troublesome of those three is measles, not the mumps, not the rubella. Those ones, even if your child has rubella, nothing will happen to them. They'll be fine. 1 week, they'll be fine. If your child has mumps, the cheek will blow up, but most of the time they'll be fine. So, but measles, that is a killer. and measles is free. We give measles at 9 months and at 15 months for free. Chicken pox, yes, you can take the chicken pox vaccine. But even if you have chicken pox, most people have chicken pox, you will recover. 1 week, you'll be fine. So you just have the rashes and then you'll be fine. So it's not like it's a killer disease per se. But trust me that all the killer diseases, they are in the ones that we're giving and they are free. So nobody should use the excuse of I don't have money not to take immunization. Go to the government hospitals, go to the health centers, go and get your immunization for free in that place. I hope that's helpful. Major ever say my son is due for 6 week immunization. Yes, he's due to take Penta, PCV, OPV, and Rota. Can I get them in general hospital? Yes, all these vaccines are available in the health center. You don't even need to go to general hospitals. The best place to take your immunizations actually is the health center. The health centers are the best because you know what? They get the immunization for free and the same money because they don't store them, they don't keep them, they get it straight from the source. Because one other thing with private hospital immunization is they're as good as where they keep it. You know, there's what we call cold chain principle in immunization. The vaccines have to be kept at certain temperature all through, from the time of manufacture to the time of administration to the child. If the cold chain is broken, that's what you are getting is vaccination. Your child will not be immunized. So it is possible to get a vaccine and not have any immune response and not have any immunization because the vaccine is already uh denatured or it has lost its potency because of lack of maintenance of cold chain. But when you go to government hospitals, especially the health centers, trust me, they don't break the cold chain because they go to the where the government store those vaccines and get it for that same day they are going to give it to. So they are very, very good with that because they have to give it and they have to because if not, everything is wasted. They don't store. So that's the good thing about them. So go to your health centers. There should always be an health center within 30 minutes of your house, and you can get your immunization for free at the health center. So that's that. Um Next question. Our time is almost up. What are dangers of a child falling when trying to raise herself in tummy time? How old is this child? Anoluwapo always puts the age of the child. A child who is doing tummy time should not be falling because that child is like 3 months or less. So where are they falling from? They are not going to fall. So a child who is doing tummy time, unless we are not saying the same thing. That's why I want to know the age. But there's no way a 2 months, 3 months old is going to fall. Fall from where to where? Okay, that is number one. But of course, don't put them on a height, on a bed without guards or things like that. They can roll. Rolling is different from falling, but falling means you mean the child stood up and then come down, but they can roll. So that is why if you are going to put a child down for things like that, make sure they're on a flat surface, not a height, not on a bed. And if they're on a bed, make sure there is guards by the side of the bed because babies can roll and that is the only way they can fall. Otherwise, there's no way they should be falling at all right? So but if you put the age of your child, then I can have some context to be able to advise you and all that. But for babies, please don't put them on the height. And all this tummy time, please, shouldn't be more than 5 minutes. Children are not meant to be on their tummy forever. And don't do it when the children are sleeping. Children should not, babies less than 1 year should not sleep on their tummy. They should always sleep on their back because of the risks of what we call sudden infant death syndrome, SIDS. So we don't want babies to die. They can, get their nose blocked. They can, so we don't want all that. So please, they should always lie on their tummy. I mean, only when they are awake and no more than 5 minutes. After that, they should go on their back. When they are sleeping, they should sleep always on their back. All right, so I hope that's helpful. So your baby should not fall, but make sure you are either on the flat surface with the baby on the floor, or if they're on the bed, there are guards around them. So when tummy time is just their head they are lifting, they are not lifting their whole body. So I hope that makes sense. All right, my time is up. Thank you so much for those of you joining me, Constance, Major Evers, those who are consistently joining us. But if you still have questions, which I know some of you may have, or you are just coming back and you're just coming back from work and you notice that the program is over, not to worry. Please go to Ask the Pediatrician Facebook group and you can ask your questions there and we'll be able to answer your questions as much as we can within 24 to 48 hours. Of course, if it's a question that required a particular specialist to answer, it may take a little bit longer, but most of the other questions we tend to answer them quickly with the support of our moderators. We thank them for their support. And also we try, if you want to learn more, we recommend you go to our website, www.askthepediatricians.com. You can listen to our podcast. All these topics, we've dealt with them in details on our podcast, on our YouTube channel. And yes, so and please follow us on all our social media platforms, on Instagram, on Facebook, on YouTube, on Twitter, on TikTok. Actually, though we're not so strong on TikTok yet, but you can follow us and learn. And please invite friends and family to join us. So thank you so much for joining me today, and I hope to see you again next week, God willing. Until then, have a wonderful evening, and it is bye from me. Bye bye.